may have a challenge getting to appointments because of challenges with their mobility, because of behavior challenges, transportation issues I hear complaints about every week. And so when appointment happens, we want to make sure that happens in an effective way. And that's what this is about, how to use a healthcare kit to help you have appointments that are useful to you and help you. So let's go ahead and start with the slides as we talk about healthcare and how to get appointments that work for you. So what is included in the healthcare kit, which you can download, and we'll have the sites again at the end in case you didn't get the papers that are included as tools in the kit. So basically, here's a list of the different things that are in the kit, all the way from an introduction. We walk you through an appointment. We mention the NTG-EDSD, a real mouthful, and that is a screening tool that we'll just briefly discuss unless we have extra time at the end. But the focus is on the appointment, and or if you need to go to urgent care or hospital, we have that at the end as well. Aha, I've learned how to press hard. Okay, so why would you want to bother with this kit? There are benefits for all the people involved. For the individual, it helps make the effort of attending an appointment worth it because it's effective when the doctor understands you and understands your health issues. For the support person who may accompany you, whether that is a paid support or a family member, it really helps you to be prepared for the appointment and prepared to follow up afterward. And for the healthcare practitioner, we're just using that as a general term. We often say doctor, but you may well see a nurse practitioner or a physician's assistant. I often see that they want to help, but they often do not have the information they need to help. And then they're not having an effective input on what the health challenges are. The other thing I see is that if they do not understand, if there's delays in the appointment or they do things that are a challenge for the individual's sensitivities, there could be behavior challenges, and that results in the doctor often being scared or frustrated. So overall, this kit provides value by reducing frustration, improving quality of care, and reducing return appointments. We're going to give some helpful hints to prepare for your appointment, and then we'll get into the nitty-gritty of some of the tools, some of the paperwork that you can use to have be prepared and have what you need on hand when you get there. First of all, ask someone to go to your appointment. Now, this is a situation where there is a paid caregiver that's kind of a given, but there is this piece. Make sure you have someone who's going to be available to go with a person to the appointment. Many people, even people who are usually well able to understand things, when they're under the stress of being at an appointment, have challenges and need someone else there. Then the next point is to create the health history. It includes your current conditions, past surgeries or illnesses, and other things, and we'll go over that in detail. And then I again will mention the NTG-EDSD, which if you're having a concern about possible dementia issues, that is an excellent tool to complete. We'll talk more about that later too. And then bring questions, and we will get to that also, and be prepared by completing some paperwork before you go to the doctor. There we go. This form is extremely important. This task is extremely important. I would say this may be an area that is the most difficult for individuals setting up their own appointments or for caregivers setting up an appointment. When you have this in front of you, before you ever fill it out the first time, make copies or go back to download more copies, because this will be a template that will help you make the correct time for appointments and making sure the appointments work. Let's start from the top. This is one that I really want everybody to understand the importance of. You'll see the things to have ready. Make sure you have them before you make the phone call. The calendar. Make sure that you know what times are available so you get it right the first phone call. Insurance card, which doctor or nurse practitioner, PA that you need to see. You, of course, want to have their phone number, but you also want your phone number, and you want the date of birth of the person who's going to have the appointment. Then use this script to make sure that you don't miss anything. And you say, my name is, or you say, I am calling to make an appointment for, and give the name of the person I would like to schedule an appointment with. So you have this all filled out ahead of time, so there's no stumbling or forgetting when you make the appointment. What dates and times are available? How long is my appointment for? Now you'll see this big arrow, request extra time for your appointment. Perhaps this is one of the most often things that are missed, is to request extra time for an appointment. You may be surprised that the normal appointment is 15 minutes. 15 minutes to clearly explain the situation, to give the individual time to talk in perhaps a slower manner or respond in a time that's right for him or her, but 15 minutes is not going to be enough. So, can I get extra time for my appointment? I need extra time because, and I cannot emphasize it enough how important it is to say this. Is it because doctors don't want to be bothered? No, it's because doctors have a lot of appointments slammed and jammed into their day. It's a whole scheduling issue. It's a reimbursement issue, and we just have to be very aware that's the reality. So when you call, something that's not on here, but that I would really encourage you to think about and maybe make as a sidebar on this sheet. If you know an individual needs extra special consideration, for instance, if the individual is going to need a Hoyer to be put on an exam table, that needs to be brought up at the appointment time when you're calling for the appointment time, not when the person gets into the room. And if a person has sensitivities to bright light, to touch, or a long waiting time, that also should be referenced right then as you're making the appointment. And I would make this time now an awareness that when the person is going to go to the appointment, the day of the appointment, call ahead, ask, when is Dr. Smith going to actually be able to see Joe? Is Dr. Smith running behind with his appointments by a half hour or an hour? You have the right to know. You can get that answer ahead of time, and that can help you. I also have some individuals who go to appointments and they do a plan where one person gets out of the car and goes in, and then the individual and the other caregiver drive around, and then there is a call made to the car when the doctor is actually ready to have the person come into the room. This can really eliminate some behavior dysregulation when a person has to wait a long time in a waiting room. So back to this appointment, at the bottom, repeat. Repeat back. You know, phones, You know, people, it's just so easy to get a confused day or time. Any of the wind nurses could tell you there's been times where we've gone to appointments and there was nobody there because there was a mistake of the actual time. Or we missed an appointment because what we heard was not the right time and then it got corrected later. But for any of you, repeat back the appointment and then write it down. Now you've got a good start. You've set it up so that you have enough time, and you've set it up so if there's triggers or sensitivities, hopefully those can be at least minimized for the upcoming appointment. Okay. The next thing you want to do as you're preparing for the appointment is to do a health history. I know, you're looking at this and going, paperwork, but it is important and it can really help a person to have an effective appointment. I want to mention that you may have a computerized documentation system called MyChart or some other version, which will have some of this information on it. And if that's the case, you might be able to go in and print out some of the information so you don't have to complete it all on this form. So at the top, your basic information about you and your doctor and your insurance numbers. Next, doctors I've seen in the last 2 years. This won't necessarily be easily available on a computerized system, so it would be a really good idea to fill this out. Might be a little painful, take some time, but it's important. And why does the doctor need to know it anyway? Well, it gives the doctor a window of understanding about other issues you may have had. Then this, I am being or have been treated for. If you have MyChart, that's called the problem list. And so that's what you'd be looking for if you just want to print it out. Again, these issues are very important for the doctor to know. Maybe you're going in for something completely different than any of these issues. But for instance, if you have seizures, and that's noted here, if you're then going in for some other problem, they need to know you're on seizure medication because they will then be very careful about the prescriptions that they would write. Okay, allergies. Now, just a warning, don't put broccoli on there just because you don't like to eat it. So keep it real. If there are food allergies, put those down. If there's medications that you're allergic to, put them down. If something like an antibiotic gives you a stomach ache, that's not really an allergy. But if you have had a rash or you've had some other significant reaction to a medication, be sure it's completed. Again, this could be on MyChart. If it's updated, you could print this out. Immunization record, we know how important immunizations are. And again, depending on what health issues you may have, some are more important than others. But they need to know if you've had updated immunizations. It may, again, be in MyChart if you want to print it from there. And I'm just making a plug. It's flu season time, so get your flu shot. Your family health history. This is not necessarily something that's going to easily come up even on a computerized system. You may wonder, why does somebody have to know if my mom has had high blood pressure? Guess what? Things often have genetic tendencies. You can't help it if your mom has high blood pressure, but it may make you more liable to have it too. So you want to make sure that you get as much information as you know about pertinent health issues that your family members have had. Now, we're not talking about Great Aunt Matilda. If Great Aunt Matilda had high blood pressure, you don't need to include that. Notice we're just talking about your immediate biological family. Medication history. This one is directed more towards things you've tried in the past that may not have worked. or the side effects were too bad. So again, this is useful information if you can get it there. And then memory tests I have completed. We put that here because there are a lot of people as they age who begin to have challenges with memory. And we would include the NTG-EDSD as a memory test that's been completed. And if it has been, be sure to bring a copy along. It's very helpful for the doctor. If there's other kinds of tests that have been done, put them down, and that will be helpful for the doctor. Okay. We're talking about the NTG-EDSD here. I think that's out of place. Okay. All right, here we go. Sorry, I got my paperwork out of place. So I'm not going to go into detail. If you have your information with you, you have it right there. You can see it's several pages long. It is a very good screening tool. And the great thing about it is it works best for people who know a person. So this is not something that the doctor completes. This is something you can complete. I would really encourage that if you sit down to do this tool, you complete it with people who know the person right now really well, and people who've known the person in the past. Because what this screening tool does is reflects the current situation for a person and what the person is currently able to do, as well as what the person has been able to do at their best. We call that their baseline. And what it helps bring out is things that may have changed and why they may have changed. And so this is a very helpful tool for people who have IDD. It's much more helpful than neuropsych testing, which is long and tedious and stressful for individuals, takes hours. That is really based on a person who has always had normal cognitive ability and no disabilities, and that is at a doctor's office with people often that an individual doesn't know. So I really do want people to be open about considering more paperwork because it can be very beneficial for the individual. Okay, we're getting closer to the appointment. Helpful tips at the appointment, and then we'll go into the actual tools. Let the nurse and staff know that you've brought questions and ask the important ones first. Remember, even when you've requested extra time, there's still going to be a time limit. If you've ever gone to a doctor at 4 o'clock in the afternoon and you didn't get in to see them until 5:30, it's because they get overtime. And so even though they may allow extra time beyond the designated time, it just all builds up. So bring the visit form, which we're going to go over next, and make sure that you have somebody or yourself to take notes and to ask for clarification. Be brave. If you don't understand an answer, don't nod and smile. We all do that. It's really easy to nod and smile, and then afterward, or even at that time, you're thinking, what does that mean? So ask again. Say, can you say that in a different way? When you're given the plan or the next steps, ask again. Ask to have the form completed that you've brought along, and we'll go into that too. And ask if you don't understand the steps that are supposed to be followed. And then have that summary completed by the doctor. We'll go over that. And then when you leave, and that's the last little tip, when you go out, ask for an after visit summary. It calls it a visit summary here, but usually it's after visit summary, because that will have your med list, hopefully an updated med list if there's new meds. It'll have your next scheduled appointments on there. It should have your vital signs and your weight if you were willing to get on the scale. And it may have written information from the doctor. Some doctors do an absolutely stellar job of writing succinct hints of what to do next. Other doctors put nothing except standard visit. But at the minimum, you will have the other information I described, and it's really nice if the doctor actually put some written information in there for you. Okay, today's visit. This form is really important. I know. Oh, another form, and that's what this is all about. These tools are forms. When I was asked to help do this whole self-directed healthcare kit, it had been done years ago. I can't tell you how many. And the BPDD decided this needed to be updated. I was asked to be involved, and the people from BPDD got pretty tired of me saying, but that's too long. That's too wordy. Let's keep it clear. Let's keep it succinct. Because I know what a pain it is to do forms, and I also know that doctors don't like to read wordy things. So bear with us. I know it's paperwork, but we've tried to make it as simple as possible. The checklist. Let's look at that checklist. Updated med list. You see that there? Updated med list. Second one down on the left. Many times that gets forgotten. Whether you have just a simple list that you've made up, if you're a parent or other family caregiver, or you have a medication administration record called a MAR, bring it and include everything. Again, with families, sometimes you give supplements, vitamins, things that you don't have in your mind as being meds, but bring them all, the whole list. Monitoring forms or charts. For people who work with WIN nurses, they know how important we say those charts are. If you have a sleep chart, a behavior chart, a food log, a BM protocol and chart, you want to bring those along so that you can give the specifics. Have a summary of medical history and medical records. Have your health insurance card. If you live in a home or residence that has a form to fill out, make sure you bring that. And here's one you might not have thought of, something fun to do. As much as we would like to have a perfect world where you walk in, you get registered as being at the appointment, you get taken right back to the room, you have the doctor and nurse come in immediately, and you're back out the door in 20 minutes, that's not reality. You are going to have to do some waiting. So whether it's for you or for the person you're caring for, have something along that will be helpful while you wait. And then any other items that might have been requested by the healthcare practitioner for you to bring into the appointment. Okay, now we have just the information. My name is, and I like to be called. So I really starred that, and the reason is I've worked with people where they don't like their name. That name has to be there. That's what's in the records. But if Joe likes to be called Bucky and he hates the name Joe, you want to make sure that it's in there, Bucky. And you want to call him Bucky. You want to go to say it's right there, he's Bucky, and make sure that the practitioners also call him that. So the appointment, who it's with, I'm a new patient or not, date of birth, male, female, person with me is and is my. That's an important one. You want to make sure that the people at the appointment understand the role of someone who's accompanying you. And their phone number next, pharmacy, ooh, that's another one. Doctors' offices are always asking, and what pharmacy is this? And if you say Walgreens and they're saying, and which Walgreens? So make sure you have that information. And then the allergies. Now we're getting to the nitty-gritty. Look at these two boxes. Okay. I am here because this is a follow-up appointment. You treated me for whatever the issue. Next line, I did, checkbox, or did not, checkbox, take the medicine. Fess up, be honest. I'll give you an example. If you have high blood pressure, and at your previous appointment, the doctor gave you step 1 kind of medication for high blood pressure, that is a diuretic. That means you're going to have an urgency to go to the bathroom, to pee. And it's going to happen again and again. And you might have an accident. And that's very embarrassing. So you decided, I'm not taking that medication. Then you come in and the doctor said, have you been taking the diuretic, the medication? And you say, I did. But your blood pressure is still very high. The doctor is going to give you another stronger medication. And then if you happen to take both, you could faint, fall, get hurt, because your blood pressure might go way too low. So it is really important to explain and to be honest. It does give you that chance. I didn't take it because. And then I did or did not do what you told me. Again, that might be taking medications, but more in this respect, we're talking about, maybe it's an exercise to strengthen an ankle, or to do something else where it's important, range of motion for your shoulder because it was stiff. Well, if you didn't do it, then they may go to the next step. Could be a brace for an ankle that you don't need. It could be an injection into your shoulder, which you don't really need because you haven't tried the exercise first. So it's super important to be honest and to give reasons here. Next thought. This is for something new. It's not a follow-up appointment. I am here because I'm having problems. And I'm having problems with. I have pain. I feel sick. It started, or I noticed it when it occurs, how often. Pesky questions, aren't they? But anybody who's worked with any wind nurse knows these are questions that we emphasize are super important. Doctors and nurses need the information. They need the numbers. If you just say, well, Joe's just been kind of under the weather, that gives the doctor no clue as to what's going on. If you say, Joe has been vomiting every day for the last 3 days after a meal, well, that gives a lot of information. If you have been attending this appointment with an individual with IDD, and that individual has multiple caregivers, this may mean that you have to get information from other people who've also been working with Joe and bring all of that information. We call it detective work. It is very important detective work to have the information, the specifics, so the doctor knows how to proceed. And then I have treated myself at home by, and again, be honest, if you've had pain and you've been taking 4 Tylenol 5 times a day, that's probably too much, but you need to let the doctor know. He might scold you a little bit, but if you let the doctor know, that gives the doctor a good idea of how much pain you are in. And if the Tylenol's not working, that really helps the doctor to know. And then you can proceed from there. So possible causes and contributing factors are down at the bottom. And again, these are changes that could be really important to know. Changes in your living environment. We know that sometimes when you've moved, it's really can be very scary and it can affect your health, can cause stress, or if you have different caregivers. So those kinds of things are important to note. Recent medication changes, recent physical changes that are listed down here in check boxes. And again, referring to the NTG-ED-SD, which can really reflect in more detail. Now, let's look at that next page. I'll say this, when I did this training in person at a People First, and everybody looked at this page, I got some giggles from people because of the naked people on there. And of course, it's not meant for humor, but it is really meant for a really good way to circle or mark a place where there's pain or sore and discomfort, any of those things. And we need it to be this specific so to help the doctor and to help the individual show where there's a problem. Too many times, doctors may take somebody's shoulder and kind of wiggle it a little bit and say, does that hurt? Now, depending on the person, that question may be a leading question, we call it, and the person may say yes, because they say yes to any question like that. So having this be filled out, completed, or having the person point, saying, are you in any pain? Yes or no, and then point to where it hurts, is much better than touching different parts and saying, does that hurt? Be aware that there could be pain in what we call hidden places, places that there's going to have to be effort to look. I'm just going to be straight out and say hemorrhoids are a pain in the you-know-where, but they can be neglected and not known about because nobody takes the time to get the person out of a wheelchair onto an exam table and to look. Sometimes people are shy or embarrassed about having pain in their perineal area, which is the area of their bottom from front to back. And so it is really important not to ignore that. Right under the picture of the human body is something you might be familiar with, the pain scale. You have from 0 with a big smile to 10 where the person's in tears. I like to help people to understand by giving my personal example, and hopefully it's not too much information, and that is that I know for myself, when I am in a lot of pain, I vomit. It's a very unhandy kind of thing to have, but for me, that's my 10. So try to help yourself understand, or if you're working with an individual who's there at the appointment, what these faces or these numbers mean. If a person says they're at a 10 and they're walking in without any difficulty and smiling and had normal appetite and all of those kinds of things, you would guess that probably 10 is not an accurate number for that pain. Below that, more details. It's worse when, and again, be specific. It's worse when I lie down, or it's better when I sit in a straight chair, or it's better after I've gone poop. Just don't be shy, don't be embarrassed, be specific. Conditions I'm being treated for now, we've talked before about how important that is. Serious illnesses I've had in the past, and then this next one. My sensitivities and triggers are. Now, you're bringing this in for the appointment. That's really useful to have that information. It's a reminder again, but I want to refer back to when you made the appointment. It's also important to try to make a point of it when you make the appointment, but don't assume that the information got back to the room where you're going to have the appointment, because sometimes information does not travel well. Healthcare practitioners I have seen since my last visit, and notice it includes the dentist. That can be a real important one. It could be a chiropractor. It could be physical therapy or an acupuncturist. Get them all down. Make sure you have really included all of those caregivers, because that is important for the doctor to know. Okay, about me. Oh, another form. But notice, this is a form that's used as an additional aid for information for a first-time visit with a healthcare practitioner. So you can fill this out once and done until there's changes. Of course, there is probably going to need to be a system where you know you need to double check it every 6 months, make sure you don't have to make changes. So you will see that we're trying to get a clearer picture of a doctor or a nurse practitioner to understand the whole of the person. So you have, again, my name is, and I like to be called. That's very important. We talked about that already. We want Bucky to be called Bucky. And then the person with me, primary support person, and that's the part that might change, as we know, because sometimes we have different people coming to appointments. Family members, job coach, and so on, interpreter, all of those names. And then, and I start this one, I am working. My job is, and my hours a week. The reason I start this is because this is going to be a surprise to most healthcare practitioners. If you work, they're going to be shocked and say, "You work?" So it's important that they know you work because it could impact, like when you take your medication, if you have to take medication in the middle of the day, or how many hours a week you're on your feet at a job. So that's an important thing to make sure that all healthcare practitioners know that you have a job if you do. Allergies, we've gone over that already. Again, triggers and our sensitivity issues at the bottom. And then on the back side, or for you another slide, is more information about who the person is as an individual. So I really like this. Worked hard to make sure that we got this all in there. Who you are as far as being mobile, and that might be different in general than the day. If say you sprained your ankle, at that point you might need more assistance, but they need to know what you usually can do so they know what the goal is. Communication, super important to have this communication. I speak for myself, or I cannot speak. I am deaf or hard of hearing, or my companion can help you understand. Just get that in there. I can communicate through. So here we have the communication devices, and be sure if a person uses a communication device that they have it along. I really want to emphasize the understanding piece and make sure that the healthcare practitioner clearly knows that even if the individual is challenged with being able to speak, that they may well understand what is said. So you may have to point that out specifically. Maybe Joe has 10 words, but he understands a lot. And so we don't want a person to be ignored because they're not able to share all the details. We want to make sure that they hear things themselves and in a way that they can understand. The second one is, I like simple terms and step-by-step directions, and I would say, who doesn't? I think that's true for all of us, and it's certainly true for most caregivers who are going to an appointment with an individual. We need the simple terms. We need the step-by-step directions to know what to do when you go home. And then I rely on the person with me to understand details. Next, we have my living situation. And again, this could be a real surprise for people. I have been to many appointments where the doctor's assumption is that the person lives in a nursing home. It's really, really important that the doctors understand where the person lives, and then on the next square, what cares are needed by with assistance by another person. This helps the healthcare practitioner appropriately deal with all the issues of the health concerns that come button forward, and as far as medications as well. And then down below, medications I am currently taking. Again, if you have a MAR, a medication administration record, or a med list separately, I have people who have 3 pages of medications, so they certainly wouldn't be able to include them all on this sheet, but just be sure that you always have the medication list. Okay, we're at the visit, you've given all this information, the doctor or nurse has done her assessment. Here's the summary of the visit form. So, top, we have a checklist. Also notice the date, and it's really important to have the date because if you keep all of these forms, which I hope you do, in a file somewhere at home, if you don't have the date and you've got a whole bunch of different ones, people forget. When was that again? So be sure you have the date at the top. Notice this is 1 page. There's a lot of space between them, and this was one where I was really direct and said, doctors don't like to fill out forms, and they don't like to take the time, and we got to keep it short and simple. So here it is, the name, the location, the phone number, next appointment. That's going to be important. You might not get that right with the doctor. You might get that when you go back out to the front to make the next appointment. And notice we have a little reminder, schedule at least 30 minutes and the best time of day for the individual. Well, think about that. I know people who are great at 9 o'clock, and I know people who can't get out and get to an appointment until 11. Or somebody who fades in the afternoon because they have to have a nap. So best time of day is really important. Now, here we have the purpose of the next appointment. What did you find today? Treatment plan and recommendations. Who else may be involved? You can see it could be physical therapy. It could be speech therapy, which is often also for swallowing issues. And then general good health suggestions. Oh boy, I know what my doctor would say. Lose weight. Maybe lots of us would have that general suggestion. We don't get mad. We can understand, and we can move on and try to eat better. Any change in medication, and here's the new medications and their purpose, and then their signature and date. So that's, you've got to be forward with it. You present it at the beginning of the appointment. You remind them that you need it before you go back out of the office. Oh, did it again. Okay. The next question, whoops. Here we go. The next sheet, rather, is a whole lot of questions. Now, these might not all be relevant for you. So we can take some time over these. But again, probably the most important thing is not to be shy about it. So we often think, well, I shouldn't be asking questions. Who am I to question the nurse practitioner? The very first one is, what is my diagnosis? And in our day and age, a lot of people like a diagnosis, and sometimes they take the diagnosis and go home and Google it and get either very scared or angry about it. So we don't really want to just say what's the diagnosis as in the name. And sometimes, to people's consternation, they hear, we aren't sure yet what your diagnosis is. And I've heard people feel really upset and disappointed, like the doctor doesn't know what he's doing, he didn't give me a diagnosis. So I would encourage patients first, if you don't get a diagnosis at this time, that there's going to be further things that will be done. But then if you get a diagnosis, you can ask for more details about it, which is what you see here about what may have caused this. People often want to have a reason. Am I to blame, or is it that I'm not being cared for properly? People aren't doing what they need to do to help me that caused it. So ask the questions and try to understand there could be more than one answer. Often what I say to people when they ask me about a specific thing is I'll say, often there's more than one reason. And I can give an example. If you have high blood pressure, that would be a very common diagnosis. Hypertension, doctor will call it. What may have caused this? Well, we'll go back to where do you have parents who have high blood pressure? If both parents have high blood pressure, you know you may have a genetic tendency to have high blood pressure. And we get to the tricky one, am I overweight? And we know if you're overweight, that increases your risks for high blood pressure. And do I like salty foods? And if you do, that can be a risk for high blood pressure. So am I on medications for something else where there could be a side effect that causes my blood pressure to go up? Right there. How many? At least 4 that could be contributing causes. Next, will I need more tests? Good question. Really good question. Next, and if the tests, we'll go down below to medical tests where you ask questions about that. So at least part of your appointment should include these questions. What are my treatment options and how much will the treatment cost? It's an okay question. If you have good insurance, you may not have to be worried about asking about the treatment cost. You might want to ask instead, is this covered by my insurance? And most likely they will know. If they won't, they can direct you. How soon do I need to make a decision? That's always a really good question. We are likely to think we have to say yes or no right now because I'm in the doctor's office. So ask how soon. And then what if I don't have the treatment? That's a really difficult question to ask. Some doctors will get huffy and say, you don't think I know what you need? But I think younger doctors, more doctors now expect you to be questioning. And it's okay to ask for yourself or for another person. I have worked with many individuals who are in the second half of their lives and who may not want an intrusive test, who would prefer to not go any further with treatment for a multitude of reasons. And it's okay to ask the questions. And then the future outlook of the condition or additional special help. Those are good questions too. So we're getting to medications. As we are talking about medications, I want to mention that many people feel if they leave an appointment without a new medication, they've been cheated. Well, what did I go to the doctor for anyway? Didn't give me anything to fix me up. So be careful of that mindset. Every medication can be useful or it wouldn't be available, but it can also have side effects or interactions with other medications. So it is really good to ask the name and what it's for. Generic version, most of the time the pharmacy will work with that. When should it be taken? Most of the time the pharmacist will also be answering those questions, how much and how long to take the medication, and side effects. So it's fine to ask these questions if you have time, but you will have a second chance with the pharmacy. Also forgetting to take it. And so what if you take too much, or will it be set up for a refill? I would say out of all those questions, will it be set up for a refill is probably the one you for sure that you want to ask about. And the others, if there's time, and if there's not time for all of those detailed questions, be sure you get the answers from the pharmacist. My experience has been pharmacies expect questions and they provide information. They're by law, they're required to give some of this information, and they're certainly open to the questions with maybe giving a little more time than the doctor would be able to. Okay, medical tests. What's the test for? Very good question. How is it done? Really good question. How accurate is it? Another one, because there's variability depending on the test, and it's really smart to ask. And what do I need to do to prepare for the test? And can I have that in writing, please, step by step? For some tests, it's nothing to eat past or drink after midnight. For other things, that's not an issue at all. For some things, you have to have special skin preparation. I could go on and on. I'm a nurse after all. But you want to have that information and you want it in writing. Then I start this one. Is this the only way to find out the information that's needed about my condition? Sometimes there's an older way, not the latest and newest test, that could also be a possibility. And it's always wise to ask. And then, when will I get the results? That's a good question too. Sometimes I just saw a person limping along yesterday, a fellow worker, and I said, got your MRI done? Yep. When will you find out? Oh, I don't know. I got to wait till they read it, and I got to wait till they call me. And that's kind of typical for any kind of assessment, like an X-ray, a CT scan, an MRI. The person who does it is not going to give you the answers at that point. It's going to have to go through the route of the person who reads it and the person who reports it before you get the results. What would be the next step after the results? Sometimes they're not going to be able to answer you in specific detail, but they may give you some general idea. How will the results be explained to me? That's a really good question too. Is there going to be a doctor's call? Is there going to be a written letter? My experience has been if there's a letter, that's going to take much longer for you to get. And I'm going to make a point here about what if you don't get the information? What if you've had a test, say a mammogram for the women out there? What if you have a mammogram and you never get the results? Does that mean, oh, everything's fine, no worries? Does it mean, oh, I'm full of cancer, I'm going to die, and they can't tell me? No, it means that somebody didn't give you the information. It fell through the cracks, as we say. So you must follow up, and at least maybe after a week, if you haven't heard anything, follow up to find out what the results are. If you do have MyChart or another way to access computerized medical information, you certainly can go in and look to see if the results are in there. I would warn you that if that's the case, it's going to be in medicalese. It's going to be in language that you are probably not familiar with. So you really want to maybe look at it, but then still follow up by, contacting whomever is supposed to have let you know about the test results. Okay, here we have surgery or hospital. So your doctor's given you the kind of intimidating, maybe, news that there's a surgery that's going to be required. The very first thing I would say, it's down the list, but is this a day surgery or will I stay overnight? I really think that's probably the very first question that most people want to know. And again, it may vary. So for some people, what would be a day surgery for Anne would not be a day surgery for Joe. If Joe has other conditions that make it more challenging for him to go home, or if he doesn't have close supervision the first night after a day surgery, advocacy is needed to have the person have an overnight stay and explain. Sometimes it's an overnight stay before surgery, sometimes it's an overnight stay after surgery, depending on the person's condition and situation. So now going back up to the list, is there another way to treat my condition? Ask. It's fine to ask. The answer, you might not like the answer, but maybe there is another way. It's fine to ask. What type of surgery, more the specifics. Have you done this type of surgery before? How many? Probably they're not going to like that questioning, but it's perfectly fine to ask. And will I need any type of anesthesia? And I can tell you, you're going to. Nobody's going to do a surgery without some type of anesthesia. There's three things really when it comes to having a surgery or a procedure. There's sedation to just kind of calm you and relax you. That's usually a pill. Then there's what's called conscious sedation, which is an IV that goes in, but technically you're still awake. You just won't remember it afterward. And then there's general anesthesia, where mask goes on, and you have an anesthesiologist watching everything because they're doing the work for you. Your body is anesthetized, so your gut isn't working and so on. There's reasons why one might be better for you than another, depending on the type of surgery and depending on if you have conditions like respiratory challenges, for instance. What happens after surgery? Good question. So will you be just in the recovery room and then you go home? Will they be looking for nausea and vomiting that might occur afterward? All those kinds of things. And how long will it take me to recover? I'm going to give you some personal information on this. Here I am a nurse. I'm supposed to know what I'm doing, right? So I had shoulder surgery. Well, I asked all the questions except, will I be able to use my hand after surgery? I thought I could. I should have known to ask. That's what happens when you think you know something. No, when you have shoulder surgery, then it's in a sling and you have to keep that shoulder from being moved. And guess what? When you use your hand, it affects your shoulder. So that was a wrinkle I didn't expect. It wasn't life-changing. I could cope, but it did affect how I could do my job. And then what if I wait or don't have the surgery? Good question. And when will I receive care instructions? You may not get the care instructions right away. More than likely, they'll be sent to you. But it's good to ask when. Okay, let's see if we can get this to work here. Okay, helpful tips after your appointment. Again, these are really, really important. We'll start with the first one. Following up, if you're experiencing side effects from the treatment, test, surgery, or medication. And I love this picture with the red penicillin allergy. I'm hoping you're seeing that clearly. It is super important to call the clinic. Here is what you do not do. You do not say, oh, I've got a rash. I'm going to stop taking this medication. The end. If you do that, one, whatever problem you had that needed an antibiotic can go revving back up and getting much worse. And two, the clinic will not know you have an allergy to the medication. It will not be put in your medical record, and somebody might prescribe penicillin at another time, and you could have a far worse reaction, big old medical term, anaphylactic shock, which means you could stop breathing. So it is super, super important. If you have a reaction, an allergy response, even a rash, call the doctor. Get a different medication and get it on record which one caused the response. We see the gentleman that looks like he's about ready to hurl, and I want to reference nausea and vomiting. They need to know about that. You need to follow up with the clinic. It may be, for instance, if you're having cancer treatment and you're having chemotherapy, that you're nauseated from the medication, and they will give you medication to help the nausea. Usually they do that in a proactive way right from the beginning, but there could be some other kind of treatment that typically doesn't cause nausea and vomiting, and they won't know unless you tell them. The other thing is there could be some other medication for whether it's an antibiotic or a pain medication, and this one causes you nausea and vomiting, and a different one would not. So you want to give the doctor's office a chance to help you out with what you need to take. So again, we also talked about getting results of tests or questions, and we've talked about that at length previously. Just want to remind you, if you don't hear about the results, you're going to need to take the time, get on the phone, wade through, and ask the questions. And there's one thing that I have found that many people don't understand, and that is when you pick up the phone and call the clinic, your doctor is not going to pick up. Your doctor is probably not going to talk to you at all when you make that call. A message will need to be left. They're busy buzzing about from appointment to appointment. And more than likely, a message will be left, and after clinic hours, you will get a call either from the doctor or the nurse to follow up on things. If there's something super urgent that you're calling about, there will be explanation at the beginning of the call about what you need to do. But don't expect that you're going to get a direct answer when you first call. I don't either. I have to wait too. And I appreciate talking nurse to nurse or nurse to doctor, but I have to wait just like you do. So expect that, and it won't be quite so frustrating for you. Okay. What if you have to go to urgent care or take a trip to the ER? It's important to have information. I would say for this sheet, you would have the basic information at the top. So all of that information that we talked about before, maybe the person with me is, and the contact number, those you might have to fill out right at the time that the person's going in. But you can certainly fill out who you are, what you like to be called, and what allergies and sensitivities you have. And then the part that's in the boxes, you're going to fill out specific to this incident. You can see it gives the details, which again, we need details. And then down below, use this next box. You could probably have filled out in advance. Check it every 6 months to make sure it's updated. And then the physical capabilities down at the bottom. This is reflecting who the person is at his or her baseline. So what the person can be able to do typically, especially like walking unaided. This is really important because when a person comes in on a gurney from the ambulance to the ER, they're going to presume because the person has IDD that he or she never walks. So you want to make sure that you reflect here about what a person typically can do so they have those goals for the person when he or she is able to improve with assistance of medication and therapies. Okay, more information with help, what a person can do, and then what assistance does need to be given, and communication again. As I said, for going to an appointment, if you have an iPad or some other communication device, a picture board, make sure that goes to the hospital with the person or to urgent care, because we can't give a person a chance to communicate if they don't have the tools to do so, and that's really not fair. I'm just going to put a plug in here too. If a person has a hearing aid, glasses, they need to go with the person or be brought in if the person is hospitalized. I'd be very, very careful. Make sure that you have a case for the hearing aids with a name on it, and a case really for the glasses too with your name on it. Things have a way of getting lost in the hospital, so we sure don't want that to happen. But again, we really want to give the person a chance to clearly see and hear while they're in the hospital, so that they can have as good an interaction as possible with all the staff who work with them. Understanding, again, really important to emphasize that a person may be able to understand what is said, even if she cannot verbalize in response. And then we specifically made this a point, special concerns or fears. I don't think any of us say, oh, yay, I'm going to be in the hospital, at least not most of us. It's an environment that we're not usually comfortable with. So when I'm anxious or frustrated, it helps me feel better if I have, and again, this may be something you need to bring from home, or it could be something as simple as an extra pillow. But I have seen many, many people do so much better when they have a special blanket, a stuffed animal, or a little video game player, whatever they use to soothe themselves and help them to be calm. They should have it there, unless it's absolutely not allowed, and that would be very unusual. You'd have to be in isolation, extreme isolation, if you wouldn't be able to bring things in. Also note, it is hard for me to sit still, or I am fearful of medical exams, being touched. I've had people who can be touched on their left side, but not their right. Make sure you put that in there. Shots. It's really important for staff to know that a person is scared of needles, not just shots, but when you're going to put an IV in or whatever, because if the person is distracted and doesn't see it, they're much less likely to hit the nurse. And that makes everybody happy. So, and then down below, who is in the person's life. That's super important too. We really want to have that completed. Family members, guardians, some of those things could be completed in advance. You don't have to quickly fill all this out. Also, medical directives and power of attorney can be completed ahead of time, and that is very important information for them to have. Okay, we pretty much completed going through all of the tools. This slide is to help you know how to access things. You can go to either of these websites to access the information from the Healthcare Toolkit. And you can go to the Wellness Inclusion Nursing part of the COW website and see other information about WIN nursing and about the WIN distance learning webinars that are in our future.